our knowledge, and what we have been passing through in our intervention experience on the field into research materials, into readable materials that those who are coming behind us also will read and learn from. That is the focus of this module, SWK 608. It is for us. You know that many of us have passed through university, we have done projects at degree level, at postgraduate level, you must have done projects, but it's not sufficient for those of us who have not taken it as priority, as one of the core objectives of social work practice: education, information, and ability to pass on knowledge and skills to others. So this is one area where we are encouraging that. Like I said, it's both an academic and practice venture that we are dabbling in, and we just need to know that we are not going to be witch hunting any group or anybody. Whatever you have, you present, and our reviewers have been able to help us to look at what each group have written and to help us put it in proper perspective. Corrections will be made, more ideas from where you are not looking at and where the reviewer is looking at will help us to paraphrase and help us to put in proper perspective what is expected of us to do as practitioners who must be able to also turn out their practice experience into research form to ensure that others also gain from their wealth of experience. This course is very, very, as I said, it is pass and move, or fail and return. So it's very important. Please, according to our schedule, which was brought out during the week, we said that we scheduled that group 2 will be coming first. We scheduled that group 2 will be coming first, and group 3 next. Then group 1 will be the last for today. Each of the groups will be spending just 1 hour. Both the presentation and the review must not exceed 1 hour. So, and we also schedule that we will be having 3 presenters from each group, 5 minutes each from each of the presenters. The first presenter, who could be the group leader or anybody so appointed by the group leader to represent him or her. Then the second person, the first person will be talking about the introduction of their paper, theories, model, or perspective. And as practitioners, we should be dwelling more on model and perspective. Then the second presenter can be picked from the group at random. We have said that from the beginning of this diet, can be picked at random. And the person will be talking on materials and method only in quick succession. So if the first presenter have been able to introduce the group and the paper, second and third presenter, please don't introduce the paper again, don't introduce the topic of the paper, just key in into what the first person has said in continuation of what should be done. Then should be talked about. Then group C, section C. The third person will be presenting the section C, which is the materials and method, like I said. Then that second person, the third person will be presenting on section D, which is the findings and recommendation. Let me repeat that again. The first presenter, which is the group leader or representative of the group leader, will be talking on introduction and theories and perspective. The second person will be talking on section C, materials and method, and the third person will be talking about findings and recommendation of the paper. 5 minutes each. You have to speak to your PowerPoint. No much talk, just speak to your PowerPoint. You may share your PowerPoint as soon as, the group leader share the PowerPoint, which others also speak to. I want to say we are doing this because we know that it's a group work, and each person in the group must be familiar with what they have done. Not that only just one person did the work uh, and then everybody go to sleep. So one person who may be called that have not actually participated may bring the score of the group down. I just pray that lucky will shine on your group to pick vibrant people among the group. That is left for me anyway. I don't know anybody. I will only pick at random for the second and the third person who will be presenting the group. I only know the group leader who I will be calling to come forward. Once again, it is not to dampen anybody, it is to sharpen ourselves. It is to make sure that our social work profession grows to bounds and limits in the community of social work practitioners all over the world. You must be sharp social work practitioners in Nigeria to give a lead to African social work practitioners and beyond. Thank you very much for being here today. I could see we have about 60 persons in attendance. We still require more to attend. Like I said, attendance today is very, very key for each person. And I know that the IT official is here who will be helping us to take the attendance. Thank you very much for being here once again. We'll be calling on the reviewer of Group 2, Dr. Loretta Onyekwere, who is here with us, to please unmute and just say hello, introduce herself to this dais. Thank you, ma'am. Over to you.
Hello, everyone.
Hello, ma'am. Good evening, ma'am.
Hi, we are with you. Hi.
Hi, ma'am.
Okay. It's my pleasure to be in this group for us to share ideas, rub minds, and at the end, come up with something that will help our profession. I am Dr. Loretta Onyekwere from Rivers State University, Port Harcourt, a social worker and also a sociologist. I was glad when I was giving Group 2 work to look at, and I tried as much as I could to go through what they did and waiting for them to make the presentation so that I could make my own input. And then at the end, we'll come up with a solid work. Just as the host earlier said, that we are going to do a work that will be publishable. And so I believe that at the end of these presentations that we are going to have today and tomorrow, we'll come up with good, solid work to publish. So thank you very much. For the group, I reviewed their work. I will be seeing you now for the first time. And I want to ask the host, do we need to share our screen? Do we need to share, put on our video, or should it be off? So that I know whether I should put off my video and then share my screen and all that. So that we'll all be on the same page. Okay. Thank you so much. Yeah.
Thank you very much. But once you have introduced yourself, you can switch off your video.
Okay. All right, sir. Thank you.
The presenter will be sharing their slides for us to see.
Okay. Thank you.
Thank you very much, Mary.
Thank you, sir.
Okay, without much ado, we'll be moving straight to Group 2. who will be presenting their work to us. In that group, we have as group leader Afolabi Feyitola Iyanoluwa. In the group, we have Adebisi Temitope Oyebimpe, Ata Temitope, Uzain Modu, Iriferi, Frank, Wangi, Stella Mwane, Okoma, Cynthia Chinwe, Shabilu Salim, Afolabi Feyitola Iyanoluwa, Babalola Olarewaju Olalekan, Odubeko Juliana Taiwo, Oyeniyi Olushola Omotunde, Atedoye Wakama. So we have 12 people in that group, and the group lead is Afolabi Feyitola Iyanoluwa, who will present first. Then we have Shabilu Salim, who will be presenting second. Then we have, who will I call now? Okay, we have Ata Temitope presenting third. I hope we will get the lines. Afolabi Iyanoluwa will be presenting first. Secondly, we have Shabilu Salim. Thirdly, we have Ata Temitope. So you have the floor, Afolabi, Shabilu, and Ata. You can unmute and speak. Also share your screen. You have 5 minutes counting from now.
Good evening, everyone. This is the true leader, and our topic for our work is impact of social work on male victims of domestic violence in Nigeria. And I also have my fellow group members there, and I will be talking. Am I supposed to turn on my camera, sir?
Yes, please, you can turn on your camera if you like, and also share your screen. Share your slide. But if you're having problems sharing your slide, just go ahead, please. The time is counting.
Hello, sir. Can you hear me? Can anybody hear me now?
We are hearing you now, so please
Yes,
start.
we can
Your
hear
time
you.
is counting.
Okay, okay. I was
Go
having
ahead.
issue sharing my screen. So, like I said earlier, our topic is the impact of social work for male victims of domestic violence in Nigeria. And I will be talking about the overview of the topic itself and the theories that we have in this work. So, this study examines This study examines domestic violence against men and impact of social work on the male victims. And we all know that in our community, men are not given like much attention for violence and domestic violence, to be precise, and abuse that comes with it. People tend to give lesser attention in our community. We tend to give lesser attention to men than we do to women. And one of the most prevalent problems social workers encounter is domestic and family violence, because every day there's always a family problem, be it the man being the victim or the woman being the victim. But this research is talking about man as the victim. And social workers are adept at interacting with the entire family and connect the experiences of each family member. That's including the victim, which is the male, that's the man of the house, the offender, and the children. Then domestic violence against men is a term describing violence that is committed against man by the man's intimate partner, like I said earlier on. And the theory that explains there are different types of domestic and family violence. We have the physical abuse, economic and financial abuse, psychological and emotional abuse, sexual abuse. All these types of abuse like that accompany domestic and family violence. Then going to the theory that explains this domestic violence, we have the attachment theory. We have the attachment theory that explains the concept of male domestic violence against men. Sorry, can anybody hear me? My network is lagging. So this attachment and learning, okay, thank you. The attachment and learning theories highlights how individuals can be trapped in a circle of abuse, either remaining a victim or becoming a perpetrator themselves. And research has found that males who have been sexually and physically abused in childhood are almost twice as likely to experience sexual and physical victimization compared to females who have not experienced childhood sexual abuse due to the nature of injury sustained and relationship. Then more specifically, research has suggested that those with an anxious attachment style were more likely to commit violence in relationships. That is, if people that have experienced something like this, it will definitely affect their relationship with other people, be it a romantic relationship or not. They suggest that an anxious attachment style coupled with abuse tends to be mediated by borderline PD. An antisocial PD mediates the relationship between avoidant attachment style and physical and psychological abuse in men perpetrating partner violence. So the overview of this study is just talking about, and there are case studies, there are examples to like the underlying examples and like causes and effects of this what's it called, domestic violence against men. Like I said earlier on, people pay attention to women being violated than to men. They're actually men that are being violated in their marriages and in their relationships. But men are known to be like the bull, like that, like it's like an idiom, and the bull like represents a strong person and whatnot. So they are seen as people that are supposed to be strong and they are not supposed to be weak. And that's why most men don't come out to say all these things, because the society will judge them and see them as being weak. I see them as being weak and less authoritative and whatnot. So that is why we have lesser people that talks about domestic violence in their relationship. I'm talking about the male victims of domestic.
Can we have Salim now? Take it up from there. 5 minutes. Salim is not there. That's gone. Okay. Number 3, Ata Temitokpe. Can you take it off from there, please? Ata Temitokpe. Ata Temitokpe is also absent. Thank you very much. Can Yarinua just do a conclusion?
Okay, sir.
Your people are not around, so just do us a conclusion.
All right, sir.
Hello, sir. Sorry, hold on. Sir, can other persons in the group represent?
Good afternoon, sir.
Okay, who is that?
This is Babalola Olariwaju.
No, I didn't call you, sorry. I called Salim and Ata, and they have successfully been able to disappoint you people. Congratulations to you. So, class rep, just go ahead.
All right, sir.
And finish your work.
So the discussion of our findings according to our research, we used 10 participants from LAUTECH. So the discussion of our findings is that the conversation begins with men telling their abusive stories that led to the admission in the hospital to meet a social worker. And these men narrate their victimization from different from their partners for different reasons. Like I said earlier, there are different reasons for this abuse. It could be financially, when the man is financially handicapped, or when the man is infertile. It could be any of these issues. And each participant decided that they wanted to share their this their story. And the interview was limited to physical abuse. Like I said, there are different types of domestic violence. We have the emotional abuse, we have the physical abuse, we have the psychological abuse and whatnot, and the financial abuse, of course. This study represents another dimension of domestic violence against men that have received very little attention, like I said earlier. And the study has provided insights into the cases of domestic violence. Our recommendation for our work is that the couple should embrace dialogue in order to, in the effort to resolve issues in marriage and also avoid cases of domestic violence. Community should provide support mechanisms. Social welfare department should also work together with social workers to provide wider sensitization projects across for awareness for domestic violence for men and women and its consequences too. Thank you very much, sir.
Thank you so much, group leader. You've done very well. Only that your compatriots disappointed you. But anyway, that notwithstanding, you submitted your paper and it has been reviewed. So we just go straight to the reviewing of the paper by Dr. Loretta Yekwere. Please come up, ma'am.
Okay, thank you so much. Could you please share my screen? Are you seeing it? Are you seeing my screen?
Just click on share.
Yes, I've done that.
Share, it come up.
Are you seeing it?
It has not come up.
No, ma. We can't see it, so we have not seen it. No, ma.
Okay, yes, it's coming up now.
It's coming up now.
Okay, it's coming up.
Have you seen it now?
Yes, ma'am.
Yes, we can see it.
Okay.
Yes, ma'am, we can see it.
Okay, beautiful. That is nice. All right, thank you, the group leader who has actually worked so hard to represent the group. Thank you, Dr. Atere, my brother from the Yoruba land. I actually tried looking at this work and I used the tracker to make the corrections or make my notes. Thank God you can see the screen now. I started from the topic and I felt the topic should be impact of social work practice, because we are looking at the activities of the social workers. So not just the social work as a profession, because when you say social work, we are looking at it as a profession. But then when you attach the practice to it, it becomes the practical aspect of social work. So impact of social work practice on male victims of domestic violence. Then I saw where you have in Nigeria. Nigeria is so broad. And when I went through your work, I discovered that you didn't cover all the regions in Nigeria. So I had to streamline it to domestic violence in Ladoke Akintola University Teaching Hospital, or your state, because that is just the only place you visited. So if you had visited other hospitals in other regions that make up Nigeria, that would have covered the work to mean domestic violence in Nigeria. So you did just, if I may call it, the case study using, or a study using the Ladoke Akintola University Teaching Hospital. So that is on the seminar topic. Then I went down to the abstract there, all I still need you to add there is social work practice. Then the recommendation, hence the study recommends, because it's just one study, so you should have the X. That has to do with grammar. So you check other places and correct the grammars, because some of the places are having wrong grammars. Social work practice. I hope you're seeing the screen. Objectives of the study. Say the general objective of this study is to carry out extensive reports on impact of
Yes,
social
ma'am.
work.
Yes, ma'am. I can see it, ma'am.
You are not working on extensive reports, rather you are
Yes,
assessing. So the general objective of this study is to carry out an extensive assessment or investigation. So that report should be off there, rather you should have either assessment or investigation, because you're not giving us a report.
Assessment or investigation.
Okay.
Yes, ma'am.
Then
yes, noted, ma'am.
Then I looked at the objectives. You know, objectives must always go with the topic. So I had to add, I say, replace with examining the role of societal attitude and cultural, because I say assessing the impact of domestic violence on men experience in general outpatient. This is actually the work you are doing. This is kind of the aim of the study. So you don't bring in the aim of the study again as specific objectives. So I try to bring in some objectives that you're going to use. I said understanding, in setting specific objectives, you don't use the word understanding, you use the measurable verbs. So I say understanding is not used in setting specific objectives, rather I use measurable words such as identify or determine in place of understanding. Then coming to your objective 4, I said replace this objective with to evaluate the effectiveness of social work intervention in supporting male victims of domestic violence in this hospital. Their work is not to provide social work programs to assist men. Their number 4 objective says provide social work programs to assist men in their romantic relationship. That is not your work, because while you are assessing them, you never provided a program for them, so that shouldn't stand as an objective. So I said replace it with evaluating the effectiveness of social work intervention in supporting male victims of domestic violence in that hospital. And of course, you know that all objectives, when you make the correction, you turn them to research questions. So their research questions will change to these objectives that I have, put in place. Then the significance of the study. Said the significance of this study is divided into 2 parts, theoretical. The result of this will contribute to existing body of knowledge. Find it, yes. I also brought in the very relevant significance of the study. I say add this significance after highlighting domestic violence against men is often underreported and overlooked in Nigeria. Therefore, this study will bring attention to the neglected issue, highlighting the prevalence. If you go down, you will see more of what I recommended. We'll have to work with our time. Then going to chapter 2, I said, read up AP 7th edition in-text referencing. Because in 7th edition, you do not bring in all the names. You mention just the first name and put a tile to it. Did you get my correction there? Cosrep, did you get the correction?
Yes, I got it.
All right, good. Then I'm scrolling to get to the next correction. Then coming to your theory, you used attachment theory. And when you were making the presentation, I was actually listening keenly to see where attachment theory, goes with this your work. And when I went through what you wrote, does not really go with it, because I could just imagine a child that was physically abused, will grow up and then begin to be also abused by the wife. Does not really go. So I said replace with gender role theory and empowerment theory that I have written I've tried to write out that theory. When you read it and read the attachment theory, you will discover that the theory I've suggested is the one that will actually go. Because in your course of explaining the attachment theory, you actually talked about gender role. And because we know that the role the men play in our society, that dominating role, will always make them not to report cases of victimization against them. So that gender role theory and the empowerment theory, I've written them out there. So all you need to do is go through it, go through the theories and replace them, remove the attachment theory. Then coming to your materials and methods, nobody made that presentation. The person to do it never came on board. So information on whether the hospital has a functional social work unit or department is very key to this study, and the caliber of staff that function as social workers. So when you are talking on the setting, see, your setting is so small, nothing there at all. You said the study was carried out at General Hospital, General Outpatient Department of Akintola University, Oyo State. It is a well-known teaching hospital in Bomosho. We know about the hospital. The work you're doing is on social work practice. So there is need for you to give us information on whether the hospital has a functional social work unit or department. Some call it unit, some call it directorate, some call it department. So what is it? Is very key to this study. And the caliber of staff that function as social workers. Give us that description in the setting. Is very, very important, so that whoever that is reading the work will actually know whether where you carried out this work has a functional social work unit or not, and the people that work there. Is that clear? So you said a total of 10 participants were used for this study, comprising both male outpatient. You use the word both.
That was a typographical error, ma. But was still need to correct that. Yes.
Okay,
It was
so
I
said remove the both there, because you are not bringing two things. Then coming to sample size sampling technique. It's a non-probability sampling technique was used to select a sample of 10 male outpatients. Non-probability sampling technique is a major sampling technique. We have two types. We have probability and non-probability. And you just mentioned non-probability. Which of the non-probability type did you use? So in my work, I say add purposive non-probability sampling technique. Purposive sampling technique allows you, the researcher, to select respondents who meet specific criteria essential to your study. So it also helps to identify individuals who have first-hand experience with social work services. So purposive in the sense that in that teaching hospital, there are different patients that visit the hospital. You are using purposive because you are directly purposively or judgmentally picking people that suffered violence. That is the male folk that suffered violence. So that is what you should add there, because what you did there is not enough. Then you now say a total of 7 respondents were interviewed, mainly social workers. You now got me confused here. Who are your respondents? And why 7? Because your initial statement said that you used 10 male outpatients. 10 male outpatient means you used 10 male that were beaten up or emotionally, traumatized by their wives. And now you're coming again to say a total of 7 respondents. Initially, you said 10. And then you said we are interviewed mainly social workers. Were you looking at the social workers alone? Yes, you could interview social workers. But then I was expecting you to say that you also, the main people that you interviewed were the violated men, because from your analysis or your case study 1, study 2, study 3, we are basically the people that we are, violated. And now you are saying you interviewed mainly social workers. Are you seeing your confusion there?
Yes, ma'am.
All right. Now you come to
I
case
think
one.
the mainly there was the contradicting words.
Make your corrections. But
Yes,
at least
ma'am.
you've seen what I picked out from what you submitted. So
Yes,
case
ma'am.
one is saying, I read all the cases and then look at my comments. I say in these cases, that is case 1, case 2, case 3, did you interview your partners to find out, that is their participants, to find out if they were referred to or called the attention of social workers in the hospital? And if they played any role in order to assess the impact of social work practice on the 10 male victims that visited the hospital for care. Who are the people that saw them? You are supposed to state whether they met the social workers or not, or just the doctors. And then I say, remember that your statement of the problem reads. Remember your statement of problem. Your statement of problem reads, this study is therefore aimed at assessing the impact of social work on male victims of domestic violence in the general hospital. So that means that you need to bring information on the social workers that they met and what the social workers did for them, and not just talking about the treatment, the medical treatment that they received. Then now I said, and counseled on adjusting his work schedule to avoid, I said, how did the counseling? Who did the counseling and which office? Was the counseling done where the patient was seeing the doctor, or was it done in the social work unit? You need to put that. You need to streamline it, bring it out and say where the counseling was done. Then I said, counseled on ways of improving his income and referred to the hospital social workers for further management. Did you interview the client to find out what the social workers did for him? You know, remember that your work is assessing the impact of social work intervention. So these clients or your participants or your respondents or the people you interviewed are supposed to tell you what social workers did for them. So when you're asking them, not just what they did with the doctors, but what they did with the social workers. And it will surprise you that they may not be able to differentiate, but from your questioning, you'll be able to know whether they actually met social workers, because that is where you're working, or just the doctors alone. Then here I said wrong grammar. The man in the outpatient department at LATEC has experience. Should be the men have experienced different dimensions of abuse. That's why I say wrong grammar. 2, how did you know that the men also suffered from other abuses when you earlier stated that the interview was limited to physical abuse only? Your earlier statement stated that your work was limited on physical abuse only. So how did you know that they also suffered sexual, emotional, and psychological abuse? And where are the other cases you interviewed? Remember, you are reporting on either 7 persons you interviewed as stated, and you also stated 10. So I was only seeing case 1, case 2, case 3. What happened to the other cases? Because your sample size is so small that you should be able to report on all of them. And that is why you use the qualitative study method. Here you can see the participants reveal that no services. Here is no wrong grammar. I say, check your grammar here. Did you mean to say this? You say men victims are just frustrated because they can find the proper avenues to deal with the situation. Can you see the? I don't think this is what you wanted to say. So go through there again and correct yourself. Yes, so please check your grammar again. This statement is not clear. There's a statement you made. They said the study reveals that men are seen as perpetrators, and therefore social workers do not understand what to do with men victims. How would you say that they don't understand what to do with the men victims? I said this statement is not clear. Therefore, explain more in order to make meaning. your conclusion said the study presents another dimension of domestic violence against men. I say, what makes this study another dimension that have received very little attention? Here he said that allow me to understand better what it takes to become a victim of this. Did you walk alone going by your statement? Look at it. He said the men shared their stories of victimization. Please mute your mic, please. The men share their stories of victimization from their male partners that allow me, and I know that you are not the only one that did the work. Oh. Allow me to understand better. So I said, did you walk alone going by your statement, which states that allow me? It's not only you. Are you getting me? Cost rep.
Yes, ma'am. Yes,
right.
ma'am.
Okay. Then you come to your recommendation. He said the key conclusion and findings formed the basis for the following recommendation. I said, my dear, you did not find out anything, no, if we go by your research topic and your statement of problem, because I had to work on your research topic and statement of problem. However, research of this nature, as it relates to impact of social work practice in the hospital, should look at these recommendations I suggested below. So go through the recommendations that I suggest. I had to bring them all out, about 4 of them or so. Do you understand? Because these recommendations,
yes,
the recommendations have to go with social work practice. We are not looking at trying to say they should embrace dialogue. They must have been having dialogue and the thing did not work. And the woman had to beat, women had to beat their husbands. So I say, the recommendation should be enhanced training for social workers by providing specialized training for social workers that focus on the unique needs, because now this is a challenge now. Some of our social workers do not know what to do when it comes to male violence. So since now is an incident, I mean, it's something that is coming up now, frequent now. We need to be trained to know how to handle male domestic, because most of us, all we know is female domestic violence, female domestic, so we need training. Then we should also, there's also need to develop and disseminate male-specific resources tailored specifically for male victims. This could include informational brochures, dedicated support groups, and outreach programs that address the social stigma associated with male victimization. Then we should also recommend that we need foster stronger interdisciplinary collaboration between social workers, healthcare providers. You know, when you interview them, we are with the doctors. So there is that need to foster stronger interdisciplinary collaboration. So you go through them, and then there's another important recommendation we should make in this work is increase public awareness campaign to educate communities about domestic violence against men, emphasizing that it is a significant and serious issue. And so these campaigns can help reduce stigma and encourage more male victims to seek help. And so hospitals should ensure strict confidentiality and privacy measures to be put in place. You know, your earlier presentation, you said that, you know, men, some of them were shy coming to the hospital and all that. So if hospitals are made to know that they should ensure that there's strict confidentiality, that will also, you know, help. And when if you go to your reference, the reference is okay. It's not bad, but we don't used to put a VOL. Volume, we remove it. That's why I say remove that VOL. Thank you so much. I would say that you actually tried in the area.
Thank you very
much. So when you make these corrections, your work will come out better. Thank you, Dr. Atere.
Yes, ma'am. We'll work on the corrections, ma'am. Thank you very much, ma. We really appreciate it, ma.
Okay.
Thank you, ma.
All right.
Okay, thank you very much, Dr. Loretta Nyekwere. We quite appreciate your succinct correction on the paper, or a review of the paper.
Okay.
I believe that all you have said. Can you hear me, please?
Yeah, I can hear you very well. Go ahead.
Okay. We believe that all you have reviewed and corrected will have been taken care of by the group, and I hope the group have recorders who have been taking the correction. And I want to say that the paper will be returned to the group for the corrections to be made and sent back to us so that you can see what you have done in line with this review. And I also want to say that going forward, each of the groups should have 1 or 2 persons who will be rapporteurs for the group, taking every correction, apart from the one that have been done on the paper. There are some that you need, maybe you notice that have not been. So please make sure you have such so that you can have a more robust correction done on your paper. I want to believe also that with the presentation and the paper that have been reviewed, your scores will be sent to us from the paper reviewer, which also will make us to know what you have done and how much you are fed in the module. That's SWK 608. So thank you very much, Group 2, for good work done there. Thank you very much, Dr. Onyekwere. We are deeply grateful.
Sir, please, I want to ask that we should send the documents for our own correction
Yes,
to you so that you'll be able
I'll
to
just
send.
tell you that she will send it to us, then we'll send to you, so that the group can look at it again and make all the corrections. Is that taken?
Yes. Yes, sir.
Is that taken?
Yes, sir.
Okay.
Yes, sir. Yes, sir.
In the course of the presentation, I noticed some of our leaders came in. We have with us Professor John Maimo, the Executive Director of the Institute. We also have Dr. Kemi Otun, the Pro-Tem Registrar of the Institute. They are with us in this auditorium. I don't know if Prof wants to say 1 or 2 things to us before we take on group 3.
Thank you so much, the coordinator of the program and our able reviewer, Dr. Nyekwere, and our colleagues in training. It's a pleasure to join you on this program. I'm very, very happy with the quality of work done and the quality of review that we had. And I want to believe that this is a step in the right direction. And the group also working closely with the review that was made is going to strengthen the work. And I'm so glad to hear that this is giving the best of approach. And we are also very serious with the business of making social work in Nigeria. Thank you so much for the opportunity to speak. I appreciate.
Thank you very much, Prof. We're grateful for being here. We know that as we proceed, you have more things to say. You will always avail us of the opportunity. We also have the Pro-Tem Registrar, Dr. Kemi Otun. I don't know if you want to say 1 or 2 things, even though your paper is for tomorrow, but then you are here with us. We appreciate it. You want to say 1 or 2 things to us before we take the next paper? We appreciate it. Thank you, ma'am.
Good evening, everybody. Good evening, sir. The coordinator, Dr. Wekwere. Good evening, everyone. Good evening, our able lecturers in the program. And I will also say thank you for giving us the opportunity to be here. And then I will also thank all the students that are here today. As we are listening, we are enjoying the system. This is a way forward to make social work a very strong profession in Nigeria. So I'm encouraging every one of us to keep it up so that we can have something to be proud of. Thank you.
Thank you very much, ma. We appreciate, ma. Okay, without much ado, we'll just move to group 3. And in the lead of that group is Ishola Samuel Ayodele. And we have the reviewer, social worker Omoja Ferdinand. And if I can, social worker Omoja, just open the video so that I can see your face and introduce yourself to us. Thank you, sir.
Good evening, everybody. Good evening, Prof. My senior colleagues in the profession. My name is Ferdinand Ojonugwa Omoja. Okay, so this is just an academic exercise, and I believe that by the end of today, we will be able to cross-fertilize a whole lot of ideas. You know, this is a learning process for both the students and all of us who are present here. So I think I just have to relax, do the review work that has been given to me, and at the same time, enjoy myself as the presentation is going on. Thank you, social worker Atere, and everybody that is online. Thank you.
Thank you very much, sir, for being here with us. We appreciate. We'll just move on to the presentation. Group 3, we have 12 people, 12 candidates in this group. We have Raphael Oluwafemi Awobaju, we have Ogulano Kehinde Adebisi, we have Ishola Samuel, we have Balogun Olubukola Elizabeth, we have Agudomoye Queen, pardon me if I don't pronounce it well. Number 6, we have Adebote Olufunke. Number 7, we have Austin Egole Stella. Number 8, we have Imaralu Osasume. Number 9, we have Ngaji Ije Ikori. Number 10, we have Okoye Francis Uchenna. 11, we have Shodipo Shakirat. And 12, we have Archibong Linda. Okay, in the order we set in the schedule, please, we like the group leader, Ishola Ayodele, to take the floor. 5 minutes, your time start counting from now. After him is Raphael Oluwafemi. Raphael Oluwafemi, please be prepared, and then Agudomoye Queen also be prepared. 3 of you have the floor in succession, in quick succession. Okay, Ishola, you have the floor, please.
Good evening, sirs. Good evening, ma'am. We are happy to be here this evening. Our topic this evening our topic for the seminar is impact of occupational stress on the family lives of social workers. As we all know that everyone is having different type of stress, and social workers they are also having their own stress as well. But the impact of this occupation that is having the stress on every family of the social worker is what we're looking at. And social workers in an ever-changing social and political and cultural environment, they are always exposed to contacts with persons of different social backgrounds, people experiencing various type of problems and challenges. in all this area, we are having multidimensional situations that arises in the risk of stress that brings stress on the individuals that are also the practitioner of social work in all over the world. But we want to stress, and stay only on the one of our environments, which we are always experiencing. In order to manage stress at work, it is important to identify the causes of stress and the impact on the family of social workers, practitioners in Nigeria. These are the things that we are experiencing. As you all know, in the management or process of the institutions which offer services to solve the challenges and problems of individuals, families, groups, and communities, several challenges are faced by social worker practitioners. The concept of today's stress, of this topic, is to stress what originated stress, or where the stress comes from in physics. And it means that the force placed on an object to force or to cause damage, or that can break it or bend such a thing. But in the case of human being, stress connotes that how our bodies react to the damage at they being placed on, or any stress placed on it. It may be either favorable or it may be unfavorable, or otherwise. It depends on the angle that we are looking at. And what we are looking at again talks about this stress. Stress can either be positive and it can be negative. So, but we want to look at each of them, both positive and negative stress that social workers are experiencing at place of work. And social workers is also vulnerable to all those things that other people are bringing onto them. They will come with different types of issues, problems, and trials of their home, from their family, environment, the community, and all those groups. But social workers are also having all manner of problem, impact, this thing that having on them, this or their families. And they will, once you are a social worker, you are just like when you are having, when people are having issues, problems, and trials, but you have to bottle your own to be able to take care of others. But one thing I want us to also understand is...
Please go to your models or perspective.
Okay, sir.
Very sharply, you have 1.5 minutes.
Okay, sir. So the impacts on spouses, the stress have impact on spouses and children and other family members. As it happened to anyone, it happens to all. And it has been stress on the way of others. And every individual reacts to stress in different ways, from one person to another. And when stress is positive, it has impact on social workers. It feels fulfilled and happy. But when it is negative, such a person will feel both bad and dejected. So it is very important for us to know that there are ways by which we can, the social workers are being, when social workers are being stressed, it affects their work as well, because there are many of these things that are affecting their families. Those things that they brought to them to be able to cater for, to care for, is affecting their family. For instance, there are people that they are having, just like what we just experienced here this afternoon.
Thank you very much, Mr. Ishola, your daily. You've gone beyond 5 minutes. So let's have Raphael Oluwafemi. Raphael Oluwafemi. Okay, is absent. A good morning, Queen. If you are there, take over, please.
Sorry, sir. There are some people that give excuses that this person that you just mentioned now says she's not feeling too well. But we have some other person that have been mentioned, like Balogun Bukola is available, and we've mentioned it to her before that she will be one of the reviewers, and Okoye as well.
No, you don't give me candidate to do that. We have said the rule from the beginning. The moderator will pick at random. It's only the group rep that have liberty to present, or the person who is to represent him or her, if he's indisposed or she's indisposed.
Okay,
so,
because Odoguboye is
Raphael
not is
absent. A good morning, Queen. Is Queen on ground?
I don't think it's on ground.
I saw her where we started.
I think she left.
I saw her at the beginning. She was one of the first people that came in. Okay. The burden is
be
on
a network problem. It could be a network problem, sir.
Network problem.
Hello? Yeah, it could be a network problem.
Okay.
I saw Queen. Can I talk in place of Queen? This could be a network problem. Maybe a network is having issue. Hello?
Group leader, you have the floor, please.
Okay, sir. I can continue.
Yes, please continue.
Okay, sir. So the
social
worker.
Your materials and method and your recommendations, please. Your materials and method and recommendation in 5 minutes.
Okay, sir. Okay, sir. So the current global competition and the stress that everybody is going through is because of this downsizing and right-sizing that happened, or merger of different work and things that happened during the lockdown and during the problems with the recession, the economic recession all over the world. So this situation is giving birth to conflict between workers and employees, which has also caused stress among workers and every other person in the society. Evidence, research, and observation and investigation has revealed that workers in every sector, public and private sector at large and small, are undergoing great deal of stress, which consequently led or leads to deteriorating employee health and decrease in performance. It affects their work and it affects their health. It affects their every family and every other thing. So all these things are affecting both the social workers and the people that they are their clients as well.
Your materials and method, and the recommendation, please.
Okay, sir. The record now is that there are over nearly every individual, every family, every work, everyone is having stress all over the world. And also, the conclusion now is that we have both practical, theoretical and practical stress that from our studies. And the result of the study will contribute to existing body of knowledge on occupational stress. Researchers will also find it as a base for further research related to impacts of occupational stress on the family and life of social workers. Practically, the study is also significantly in the sense that policymakers will use it to formulate development policies that will enhance sustainability and occupational stress on families of social workers and the country at large. Social workers will also rely on it to know more on the social work, occupational stress and impact on family life and their area of service. Thank you, sir.
Okay, thank you very much, group leader, Shala Yadele. You have tried. This you've rescued your group members, having been separated by two. So, without wasting much of our time again, we just go straight to paper reviewer, social worker, Omoja Ferdinand. You have the floor, sir.
Good evening, everybody, once again. Let me come. Okay, thank you, sir. Thank you, social worker Atere. Good evening, everybody, once again. I want to commend the group for looking at impact of occupational stress on the family life of social workers. It is a very topical issue because because many social workers assume that they solve people's problem, most time they don't acknowledge they have problems. So they find it difficult to seek for support. So it is very important that we are bringing occupational stress on the family life of social workers. So having said that, let me start by saying that the seminar topic, your topic should read, because I was looking at your methodology and the people you chose to sample. Impact of occupational stress on the family life of social workers in Ladoke Akintola University Teaching Hospital, Ogbomoso, Nigeria. Please be specific. We go just say impact of occupational stress on the family life of social worker. Where is your study area? So your topic does not have a study area. And when I was looking at your methodology, I saw you sampled 7 social workers. So, and all of them are from Ladoke Akintola University Teaching Hospital. So let your topic read, impact of occupational stress on the family life of social workers in Ladoke Akintola University Teaching Hospital, Ogbomoso. Let's go down to your abstract.
Okay, sir.
Your abstract, even the structure of your abstract. The structure of your abstract, you don't paragraph abstracts. You are having 1 and 2 paragraphs. Then the indenting in the first paragraph is very, very unnecessary. So your paragraph will be in 1 paragraph, and I've said that indenting is unnecessary. Now, as I'm looking at your abstract, a lot of things are wrong. You talked about strategies. Second to the last line, the strategy social workers use a variety of strategies to cope with the pressure and combat stress. So I say, what are these strategies? Identify these strategies and include in your findings. From what I understand, you are doing a qualitative study because you are using in-depth IDI to do your study. So you are going to use content analysis to do your work. So what you are going to divide your findings into teams. Me looking at your work, I will be able to tell you the teams you will divide your work into. You should be able to talk about what are the causes of this organizational stress. What are the effects of this organizational stress, which is the impact we are talking about. Then what are the strategies that they use to be able to deal with this occupational stress. So with this now, you already have 3 teams to work on. So I think your abstract will read, social workers who work in an ever-changing social, political, and cultural environment are exposed to persons of different social backgrounds, people experiencing behavioral and the rest. Then, when you come now, say this stress, no doubt, impacts negatively to the social workers, not only as an individual, but their family life of the social worker. This, in essence, okay, they have been able to justify why you want to study this. You now start by a total of 7 social workers, males and females, working in Ladoke Akintola University Teaching Hospital of Ogbomoso, we are used for the study. Data we are obtained through the use of, you say, semi-structured interview. But you need to be very specific that you are using IDI, which is in-depth interview. Then data collected, we are analyzed using, you analyze your data because it is a qualitative or a study using content analysis. All these things are conspicuously missing in your abstract. So once you're able to, in your abstract, you have you talk about the topic, you talk about the study area, you talk about your methodology, you talk about your findings. If you have recommendation, you give your recommendations. Now, in your chapter 1, a study of this nature globally need to have a type of literature that comes from maybe international perspective. You narrow down to Africa, then come down to Nigeria and your study area. This standard was never followed at all. So I want to, in your introduction, paragraph 1, I say, please recast and make it more meaningful. Then in your paragraph 2,
okay,
you say, at present, social work managers. I don't think you want to study social work managers who assume the response of offering services to group individual with psychological blah blah blah. In fact, I am reading like, okay, up to 6 words, up to 6 lines without a full stop. So I suggest you find a way to break your work in short sentences so that they will be able to create meaning in what you are doing.
Okay, sir.
Is that clear? Yes.
That's clear, sir.
So that was in page 2 still. Even if unconnected with stress and issues of, okay. You say the situation that social workers managers face are often characterized by a debilitating level of intensity of stress, which has a very powerful impact on the stressors that they themselves experience. If you say powerful impact, what are these powerful impacts? Is it fatigue? Does it lead to low esteem? Now, the last paragraph, I think I'm seeing less than 4 lines in your last paragraph in that introduction.
Yes, sir.
Completely expunge. It makes no meaning to the work you are doing. Then when you write a work of this nature, you try to see how you can reintroduce the topic in the last paragraph of your work. Okay, this is just the introduction. Now, in your background, in page 3, I saw where you have social work is an occupation vulnerable to high level of stress due to the nature of the work. I don't know what is causing the break in between that. You just have THED in a line, and that is all. Then you break work. So I think you should be able to look at it to find out what is wrong with that. Even at that, when you are putting this, that they are vulnerable to high level of stress due to the nature of work, the complexity of social problem and dynamic, this is not what you are saying. This is information you got from somewhere.
Yes, sir.
So you should be able to give us source. So it tells there are places I added if in your comments, you are going to see it. There is a place you have letter, the term came to be used in psychology and life science. You now have LETTER, letter. Are you writing to somebody instead of LATER? You need to be, you need to be mindful of the words you are using to be able to suit typographic error, but it's you people that wrote it down. So you should take responsibility for what you are presented.
Okay, sir, no problem, sir. It's noted, sir.
Now, in page 4, the second sentence there say, the majority of social workers have master's degree, are licensed, are most commonly practiced in mental health, child and family services, and health. Then, Then I ask this question because you say, which take I thought 2023, is this thing you say, is it applicable to Nigerian? The majority of social have master's degree. Are you sure? You know? So, then, as I'm saying this,
We can't hear again.
Hello, sir.
We are not hearing again.
Hello, sir. We cannot hear him again.
I think that's due to network. Let's just give him some few seconds.
Okay, sir.
So we can't hear again.
So we should give him some seconds. Maybe it's a network issue.
Hello? Hello?
They said we should give him more time. Maybe his network of his side is having it.
From the reviewer. Let's hold on a little.
Okay.
Yeah, he's trying to log back. He'll soon join us now. While we are waiting for him to come back, I want to announce that group one should be getting ready. That's the last group for today. Group one should be getting ready. Network will be very erratic from their end. I don't know. Maybe we should just proceed when they are back. And with the same phone.
Okay, please, can you hear me?
Yes, sir.
We can hear you now.
Okay, thank you very much. It's okay, please. Sorry about that. Now, in your statement of problem, I just gave a recommendation of what is expected for you. I talked about the ideal situation, what is on ground, and then identify the gap to be able to reintroduce your topic. And I now give an example. You can start by saying, in advanced countries, you now put Canada, Britain, whatever, and other developed countries of the world. Efforts are made to address stress and challenges social workers pass through as they engage or provide intervention to clients. These efforts are in the area of, is it recreational facility? Is it in area of trying to share their work schedule? Whatever thing it is that you found out, you state it. Then mention those interventions employed to protect social workers from stress, from operational stress. Once you are able to do this, you have presented the ideal situation. There you continue. In Nigeria, the situation is not the same, as there are no conscious efforts put in place to protect social work practitioners who work assiduously to provide care and support to clients. This is associated with lack of interest by government to provide better working conditions for workers generally, not to talk of social workers. Then after that, then you can now talk of issue of social workers not having the nerve to open up when they have problem or when they suffer from post-traumatic stress disorder as a result of their contact with their clients.
Okay, sir.
You may say, and give reason why they do so. Maybe because so that the clients will not see them as if maybe they too, who are providing support and care, also lack or are weak. Now, you can now end by this situation call for deliberate effort to be made to create channel where social workers can seek help and support anytime they experience stress as a result of living their daily life, whether intervening for clients or living their normal family life. Then, with this, you can now reintroduce your topic because I've been able to provide a kind of intervention that will help you to reintroduce your topic.
Okay, sir.
Now, I've mentioned the point that your study should be Ladoke Akintola University Teaching Hospital.
Okay, yes, sir.
Study. Say the general objective of this study was to carry out extensive reports. It can be to investigate or to explore. Since it is a qualitative study, it's going to be to explore the impact of occupational stress on the family life of social workers in Ladoke Akintola Teaching Hospital, Ogbomoso. Then, your objective we will start with the way you started your objective, the specific objective is worrisome. The first one, the sources of stress experienced by social workers at work and at home. Ways in which, and this thing are all of them are in this thing, small letters. So your objective will be to examine sources of stress experienced by social workers to determine how stress or whatever thing you want to talk about. So it must be to determine, to examine, to investigate, not the way you have them presently. Is that clear?
Yes, sir. Yes, sir.
Yeah.
Sir.
Then your research, then make sure that your research question align with your objective. Your research question 4. Are there any organizational policy and program designed to assist social workers in dealing with stress? This type of question is a question of yes and no, and I know that is not what you intend. So you can say, what are the organizational policies and programs designed, not are there? If you use are there, you're not giving the impression of yes and no. Your significance of the study is scanty, especially your practical significance. State how policymakers and social workers can benefit from the study. So please work on your significance. It is very, very scanty. Although you made effort to talk about the theoretical significance, but your practical significance should have a place for social workers themselves, the social work practitioners. You should also have a place for policymakers or any other group that you identified. Your literature. I'm seeing some, when you are talking about the concept of stress, in your second paragraph, believe. Scholars have tried to separate positive and negative stress. For example, Bashir 2020 belief. I think it should be believed.
Okay.
A lot of those kind of grammatical error were corrected. Then there are some places that I say you should put source. Again, the way you are writing your in-text reference is worrisome. So you should be able to download your APA 7th edition. You can get it on Google so that you'll be able to reference in-text appropriately. Now, when you come to your page 11, decreased productivity due to high level of stress, increased expenditure for recruiting. I say recast this and make it more meaningful. This is too short a paragraph. So even if you get a quote from a source, you should be able to make meaning out of that quote you get, so that what you are writing will be able to flow. Then where you have previous research workers, job satisfaction, lack of commitment, and increased turnover intention or actual turnover, you just write the name of the author. It doesn't make any meaning at all. So I was like, what are you trying to say here? Now, I saw where you are talking about job withdrawal. And at the same time, you are also talking about work withdrawal. You gave an example of job withdrawal, example, turnover intention, transfer intention. Now you go to work withdrawal, example, lateness, absenteeism, and unfavorable behavior. So I was wondering, what is the sense of differentiating job withdrawal and work withdrawal, except you are able to tell us what you mean by job withdrawal being different from work withdrawal. So let's go to your theoretical discussion, where you review some theories. The way you review all your theories, they are very worrisome, apart from the fact that they did not speak to the topic. I think that, for example, a theory that is talking about occupational stress have a lot to do with empowerment theory. So empowerment theory should be one of the things you should consider. Most of your theories you have here, the spillover theory, the compensatory theory, the segmentation theory, all of them are talking about job satisfaction. So your topic is on occupational stress, on family life of workers. Now, if you want to write theory, you want to review theory, you need to say, what is the people who propounded the theory? What are the major tenets or assumptions of the theory? Then when you now finish that, you now say how you can now relate it to occupational stress. So do a complete review of your theories. then I suggest that at least you must have empowerment theory as the theories you reviewed. Now, chapter 3, material and method. I don't know why chapter 3 still have some material with the flow of chapter 2. Now, in your research design, you say both qualitative and quantitative method of data collection were used in this study. And I say I did not see the quantitative method. Even the IDI or whatever thing you use, the instruments were not made available to me. They were conspicuously missing. You know, so if you are using a qualitative study, you are using FGD or IDI, you should be able to present it. At least let the person that is reviewing your work see what you have done. So this quantitative method should be expunged. You did not do any quantitative work here.
Okay, sir.
Do you understand? Yes, so now there are places I say something was used to collect data on the profile of the respondent and organization. A semi-structured interview schedule was used to elicit information on. These things are not, should not be in your research design. Their place is not here.
Okay.
Then, I don't know, participants you have here, I don't know if it is your sample size. A total of 7 participants were used for this study, comprising both and female in lab. So you now see Iladoke Akintola University Teaching Hospital, Ogbomoso. You now see why I say your study should be, the topic should read, should include Ladoke Akintola University Teaching Hospital, because that is where you are studying. Now, a total of 7 participants were used for this study, comprising both male and female. Who are these participants? Where did you get them from? Are they from the social work unit of Ladoke Akintola University? What did you use? You know, so you should be able to tell us the technique. Okay, going down to your sample size and sampling technique, I'm now confused. Sample size, participant. Say non-probability sampling was used to select a sample of 7 social workers at Ladoke Akintola Teaching Hospital. Then I ask you, what method of non-probability sampling technique did you use? Is it the convenience one? Is it the voluntary response? Is it the purposive? And just like the other reviewer has commented in the other presentation, it is best for you to use purposive, because we are dealing with social workers who are working in Ladoke Akintola University Teaching Hospital. Then we also try to find out these people who are working in that social work unit, are they social workers? The 7 participants that you have used, are they social workers or are they taking the works of social workers? Because you want to study the
Hello,
effects.
sir. We cannot hear anything again. No.
Okay, I mean, did you get what I said about sample size?
Yes, sir. I can hear you, sir.
So I'm now saying, okay, now your sample size, your sampling technique. You know, I said, what method of non-probability sampling technique did you use? Is it convenience? Is it voluntary response? Is it purposive? And I said that I would prefer that it will be purposive, because you are focusing on social workers. You know, the people who have a particular characteristics that you needed to interview, because we are talking about occupational stress on the family life of social workers. So if you interview any other person that is not a social worker, it then means your findings will be very faulty. Then instruments. In-depth interview was employed. This comprised semi-structured in-depth interview. A total of 7 respondents were interviewed, mainly social workers. Now, you can now see why you did not have quantitative method when you are talking about you use both qualitative and quantitative method. There is nothing wrong in using quantitative and qualitative method. But the issue is, if you say you are using qualitative method and you are using quantitative method, we should be able to see the instrument you use for the both method. Now, you have no method of data analysis. So is there no method of data analysis? But you have it in your abstract. And I've said that it should be content analysis. And once you are able to transcribe the original information you get based on the findings you find out. You should be able to divide your findings into teams. And you also need to be deliberate in your instrument, your IDI, to be able to, bring out the findings that addresses the theme we are going to talk about. You should be able to ask questions that addresses the causes of occupational stress. You should be able to ask questions on the effects, and you should be able to ask questions on the coping strategies that they use. Now, in your chapter 4, discussion of finding, objective 1, what are sources of stress experienced by social workers at work and at home? These things should come under teams. If you want to discuss your findings, you discuss them under team. Sources of stress expressed by social worker. You should be able, at this point, you should be able to be mentioning the sources of stress that social workers experience. The way you have them, objective 1, objective 2, objective 3, objective 4, is not how it's supposed to be. So what you are supposed to have is, you should be discussing them under teams. Is it on causes of occupational stress? Is it on the effect? Is it on the coping strategies? If you were able to do this, then your work will be able to come out and be very interactive, that anybody that is reading it will enjoy what you are doing. Then at a time, I was looking at your discussion, I'm seeing something in bullet form, dash, poor physical working condition, dash, schedule inflexibility, 100%, dash, meeting at night, 80%, dash, long working hours, 100%. Where did we get all this percent from when you are not doing a quantitative study? So there is a whole lot of mix-up. I just highlighted those places. You have your percentage and this thing, bulletin. I just say meaning. What is the meaning of all this? Now, your objective 2, you wanted to talk about how stress manifests. So if you have a finding on how stress manifests, you should be able to see manifestation of stress as a theme in your finding. Do you understand what I mean? Now, if you want to quote verbatim what somebody said, they should be in parentheses. You see, if, for example, if you made a point, majority of the social workers came home to what has termed the second shift. If you're now talking about second shift and you want to put verbatim what somebody talked about second shift, you should be able to be, you have that quote. At the end of the day, you also have that quote. So the way it is presented, supposed to be in middle. That is the way you draw it, it will come in middle. So you should be able to state the type of stress the people experience before you begin to also give the quote.
Okay, sir.
I think I have other places where you also have percentages where you give, and I'm asking why the percentage in the qualitative study, and now say you should please expunge. Then I think objective 3 wants to address a theme that talks about strategies used by social workers in coping. So you will see the way I was commenting on them. So this objective 1, objective 2, objective 3 should completely go. But you can now say strategy used by social workers in coping with occupational stress. You now begin to state your finding based on the strategies used by social workers in addressing the occupational stress. Now, you came down. Although social work managers, please, I've said, let this thing be social work practitioners, and you started putting something when you are talking about your finding. Most 2021 has indicated that these techniques can only go so far in reducing the coronary proneness of the work setting. According to him, please be original in your finding. When you are doing your finding, you are not quoting somebody. It is at that place you are doing your finding. It is what you have done in the field. Nobody has helped you to do that work. Tell us what you find. Then conclusion. employee have found difficulty in taking days off from their work to catch a good rest and recuperate, or to sometimes visit distant, what you have in your conclusion is not what you found. Your finding and your conclusion is completely different from your finding. So please rewrite your conclusion to reflect what you found in your study. You know,
Okay,
you are concluding what you found in your study. Then your recommendation. Yeah.
Okay, sir.
I think your recommendation 1, I say, is hanging. What are adequate plans to make? That is, what is expected from you here? Organizational need to consider job stress as an important health and safety issue in their operation and make adequate plan for it. If this aspect of life is not well taken care of, it can lead to more things than envisaged. So I say the suggestion is hanging. What are the adequate plans you think organizations should make to be able to address occupational stress? Now, in your recommendation 2, just start with where you have managers. Forget this place where you are saying as a corollary to the foregoing. It is therefore recommended that you just say managers and company administrators should develop the job schedule in such a format that will have break or rest period and early closing time. These are your recommendations to be able to address occupational stress for those who suffer problem of work overload. Now, so you have a lot of social work managers in your write-up. Then I completely agree with your recommendation 4. There should also be provision for employee training in the area of stress management periodically, so that employees can personally be conscious of what they need to do to stay healthy and to stay productive. That's your recommendation 4 is very perfect. I just say perfect in this place. Yes, I think let me then, as I said before, your reference, even the end text referencing, they did not comply with the APA 7th edition. So I recommend that you download the APA 7th edition, study it very well. It will also help you to further your study so that you comply with the appropriate APA 7th edition standard. Thank you, and God bless you.
Thank you very much, sir. God bless you, sir.
Thank you. Thank you very much, sir. Really appreciate it, sir.
Thank you very much, sir.
Thank you very much, for that elaborate review paper. Just appreciate it. Is there something that the group leader wants to say in 1 minute?
Thank you very much. We appreciate our reviewer and Dr. Atera as well, and everybody. We have taken note of all the corrections that have been made, and everything shall be properly adhered to. Thank you very much, and God bless.
Thank you for the good work, class rep. Group rep. We appreciate you. The paper will be sent back to your group. Then you will look at it, do all the necessary correction, and then return it back to the reviewer to see if all he has reviewed have been taken care of. I also believe that our reviewer must have called you by now, so that by tomorrow we will receive the score from him. So thank you very much. I believe your group member also, as rapporteurs, have taken some other notes to look at when you are doing your group review. Thank you for the good work.
Thank you, sir.
Okay, we have the last paper for today, Group 1. In Group 1, we have 13 candidates, and the reviewer of the paper for Group 1 is social worker Mbina. And social worker Mbina open his video and introduce himself to us.
Hello. Good evening, everyone. My name is social worker Mbina Ita. and I'm standing in to review the work of group number 1. Thank you.
Thank you, sir. Okay, in group 1, we have group lead. Who is that? Okay, we have as group lead for group 1, Oshonuga, and other members of the group are 1, Abubakar, Asmi, Mohammed. We have 2, Aremu Misrat, Bolanle. 3, Giwa Abdulhamid Salami. 4, Muritala Damilare. 5, Okegbemi Joshua Adeyanju. 6, Salami Shehu. 7, Adeni Oluwakemi Adebisi. 8, Aziz Juliet Adefumilola. 9, Ochonugoro Omenogo. 10, Oshonuga Feluwa. 11, Ajibose Olalekan Isaiah. 12, Adekoya Abela Feluwa. 13, Cynthia Ezra Jumbo. So we have the team lead, like I said, Oshonuga Ifeoluwa will be introducing the paper, while Giwa Abdul Hamid Salami will be the second person, and while Ochonogo Sipowe Omenogo will be the third person to present in the group. In that succession, if anyone you are raising your hand, what is it?
Yes, sir. Please, sir, not all the 13 people were available. We are just 9 in the group. We did not hear from other people. We are just 9.
So from my end here, we have 13. So if you are 9, if I call anybody that you have not seen in that group, just let me know.
Yes, sir. The second
is Ochonogo or Menogo in the group?
Yes. Yes.
You are Abdul Hamid Salami in the group?
Salami, yes. Yes, Salami. Sure.
Okay,
Salami.
so those are the 2 that are presenting alongside with you. Understand? So you have the floor, group 1.
Good evening, everyone. I'll be presenting on the effect of social work communication competence on persons living with disability in Nigeria. In the context of social work, communication skills encompass a wide range of verbal and non-verbal techniques, which should be used by practitioners to establish rapport, to convey empathy, to elicit information and facilitate collaboration with clients. Effective communication in social work is characterized by active listening, empathy, cultural competence, and the ability to adapt communication style to meet the unique needs of our clients. Communication is really important in social work because it helps social workers to connect with people and understand their needs. Social workers use both talking and body language to build trust, show empathy, gather information, and work together with clients. Good communication in social work means listening carefully, being understanding, respecting different cultures, and being able to adjust to how you communicate based on the persons you are helping. When working with people with disabilities, social workers need to be patient, be sensitive, and be aware of the challenges they face, learning and challenges they face while dealing with clients with disabilities. The perspective involves, we analyzed existing research literatures which is related to our topic in order to inform and support the development of new intervention and approach within the field of social work. This perspective helps us in gaining a better understanding of current knowledge and identifying the gaps in the literatures, and it also guide our practice and research. Reviewing the literatures, in the literatures and perspective presented in this study, help us to highlight the critical importance of effective communication skills in social work intervention with persons with disability. Thank you.
Okay. Can we have Omenogo?
Yes, sir. Good evening, sir.
Yeah, go ahead, please.
So I'll be taking over from where she stopped. She handled the perspectives. So regarding the methodology for our paper, we conducted a literature review by reviewing relevant scholarly articles, books, and other literature related to our seminar topic. And for our analysis, we used secondary data sources such as scholarly perspectives, case studies, and academic studies to identify and obtain the relevant data necessary to plan out the trends, patterns, and insights that are related to our topic. And for the ethical considerations for our paper, we observed the following. First, there was no instances of plagiarism or other research misconduct in our paper. Secondly, the goals and objectives of our research were not overstated or fabricated. Thirdly, the study abided by neutrality and objectivity standards. And finally, to prevent any biases from entering the research, impartiality was upheld during the process of us conducting this research paper, sir.
Are you done?
Yes, sir, that's it for our methodology, sir.
Okay, Giwa, can you take it off from there?
Good evening, sir. Good evening to you, everyone. I'll be taking the review of the related literatures. So, a study conducted by Adiba and Ojo 2018 examined the perceived importance of communication skills among social workers in Nigeria when interacting with persons with disabilities. The findings also reveal that social workers recognize the crucial role of effective communication in fostering meaningful intervention and building rapport with clients. Our study highlighted the significance of communication skills in facilitating support and empowerment for persons with disabilities in Nigeria. So, according to the study of Adewusi Oyeyemi 2017, conducted a study on communication competence and client engagement among social workers in Nigeria. So, according to them, the scholars explored the relationship between communication competence and client engagement in social work practice. Adewusi and Oyeyemi also highlighted the significance of communication skills in building rapport, establishing trust, and fostering productive relationship with clients, which also include persons with disabilities. Now, going forward, the study also emphasized the need for social workers to continuously refine their communication skills to enhance their effectiveness in intervention with diverse client populations in Nigeria. Now, according to the research article of Ogunlade and Akeni 2019, the author explored the most effective communication strategies employed by social workers in Nigeria to achieve positive outcomes in intervention with persons with disabilities. Their findings also indicated that active listening, use one of non-verbal cues, and cultural sensitivity were key strategies utilized by social workers to enhance communication and engagement with clients. Our research emphasized the importance of adapting communication approaches to the specific needs and preferences of persons with disabilities in Nigeria. Thank you. Hello. Hello.
Hello? Hello, I don't seem to be hearing you again. Okay, thank you very much.
I guess it is done.
Okay. Okay, thank you very much. We give the floor to social worker Mbina Ita to review the paper that have just been presented. Thank you very much, social worker Ita. You have the floor.
Thank you, Dr. Atere. I also want to extend my heartfelt appreciation to Group 1 for putting in your best to ensure that you bring something of this nature to the fore. It is actually true that there is no perfect paper. And as such, while going through your work, I was able to figure out some things that I felt is necessary for us to address so as to make this paper better than it is now. To begin with, I was worried when I saw your topic. You said effects of social work communication competence on persons living with disability in Nigeria. Now, if you give a second thought to that topic, you will notice and agree with me that the topic is vague and it lacks direction. And as such, I would suggest you structure it this way. Impact of communication skills in social work on persons living with disability in Nigeria. The names of members of this group, you place them in a parenthesis. I don't know. Please ensure you remove it. Going forward, your abstract, please, the way you presented your abstract, it's totally unacceptable. Your abstract should be able to capture your topic, the area of interest, findings, methodologies, and recommendations. So you should also ensure that your abstract reflects your method of data collection. And all these are obviously missing in your abstracts. Going forward to your chapter 1, please ensure that no subheading is hanging. Your chapter 1, you have introduction, and that introduction is hanging. Please make sure something comes under that introduction before you start talking about the background to the study. And your background to the study should capture the whole idea of your topic. But I was worried while reading your work. I noticed you said little or nothing about disabilities in your background of the study, and that is not acceptable. So try to talk about what disability is all about. After all, your interest is on how communication skills in social work can help social workers in rendering services to people living with disabilities. I also noticed that your work did not come with paginations, no number. You didn't number your pages, and I don't know how to even point them out, because in your background to the study, in one of the paragraphs, almost like 2 or 3 paragraphs, you don't have references, no in-text citation. So ensure your references are appropriate, or you reference the appropriate authors to enable this work pass plagiarism test, because it will amount to academic theft if you should leverage on someone's work without recognizing the person by referencing the person. Going forward, still parts of your background to the study, I made a comment there that part of it is sounding like recommendation. You can imagine, just at this level, you're already recommending the work or making some recommendations. And this is taking the space of you talking about disability, talking about communication, and how this is germane to social work practice in rendering services to service users, especially to people or persons living with disability. Please remove or rephrase. And in your background to the study, you succeeded in identifying the fact that communication skills in social work is germane, is key in rendering service to persons living with disability, but you failed to inform your readers on how this work or this paper seeks to create awareness and address the challenges associated with communicating with people living with disabilities. So, in other words, you need to identify a knowledge gap and try to explain in a way your readers will understand how this paper seeks to fill in that gap. Going forward, your statement of problems. You say, despite the existing literature on communication skills in social work practice, there is a gap in knowledge regarding the specific impact of these skills on intervention outcomes for persons with disabilities. You said all this without stating where you got it from. I don't know why you would say this important information as of this nature. You just decided to state it and without referencing anybody. Please, I will advise you look for the author and reference the author. Going forward, still on your statement of the problem, I said, please state the research gap that this study seeks to fill. And I think your statement of the problem is too scanty. I will advise you added more flesh, please. Then your objective to the study, I think I have little or no problems there. Also with your research questions, you were able to marry them and make them look good. But then I have serious problems with your significance of the study. In fact, your significance of the study is passive. Make sure it captures both the theoretical and practical significance. You should also tell us how important this study or this work is to the social work profession, or how useful it is to social work profession. And while I was going through your objective of the study, although your topic captured social work anyway, but I was bothered, I was concerned as to why you will be writing something of this nature without at least making reference to the social work practice in your objective. So I would advise you try to see how at least one of your objectives captures how communication is important in this, to the profession, that social work profession. Going forward, your chapter 2, review of related literatures. Then you now have 2.1, perspective. I don't know what you had in mind, but you just left it hanging. Perspective, and you now turn to 2.1.1. So please do not leave any subheading hanging like this. It is not acceptable. I was able to address most of the problems the issues I cited in your chapter 2 under literature review that has to do with in-text citation. Please, I will advise you visit your upper style of 7th edition of upper style of referencing to update your in-text citation ability. Okay, still on your chapter 2, literature review or review of related literature, you made mention or you made reference to a study carried out by Adebuju et al. And when I went down to your in-text citation, I noticed it still appeared that way. I don't know, but I will still encourage you to see how you go through your upper 7th edition to see if you're supposed to leave it at that. But ideally, if it's just 2 citations, please make reference to mention the 2 authors. If it's 3, mention the 3 authors, especially when you're referencing them for the first time. You still repeated the same mistake you made earlier in chapter 2 when you left a subheading hanging under your chapter 3. You said, chapter 3, you said methodology, and you left it hanging. I don't know what you meant there. And while going through your guide, your research guide, the research guide that was given to you by the institute, I noticed that your chapter 3 is supposed to be captioned materials and methods, not methodology. So please try to see how you can up your game when it comes to paying attention to details. Now, going forward to 3.2, that is research design. You started by saying that empirical reports, published papers, and doctoral dissertations have all included reviews of this literature in their research. Please, this is not a research design at all. You only explained it. So clearly point out and explain the research design you are adopting for this study. You need to do a thorough job here, please. Go back and rework it and remove the repetition, because still in the paragraph, I also noticed another repetition. So please remove it and rephrase it. Then going to method of data collection. I don't know, maybe it's because of the repetition because of the repetition, research design was 3.2 and methodology or method of data collection is still 3.2. So please check it out and make the needed correction. Your data of method of data collection, you said a literature review was conducted by reviewing relevant scholarly articles, books, and other literature related to the seminar topic. Please spell out the total number of all the materials. Yes. Specify the number of books, specify the number of journals, papers, and lot more that were reviewed in the study. Your data analysis, and I don't understand. You kept repeating 3.2, 3.2, 3.2. Even your data analysis is carrying 3.2. And you said secondary data sources such as scholarly perspective, case studies, and academic studies were used to identify and obtain relevant data to identify trends, patterns, insights related to the topic. This repetition, or what you wrote under data analysis, is a repetition of a method of data analysis. In fact, you copied. I recommend that you copy everything here and put it at the beginning of your method of data analysis instead. Your data or your method of data collection, you are expected to explain the method you adopted in analyzing the data gathered. So I would suggest you make use of thematic data analysis. So please, you are expected to do a thorough job there to make your work clear on the method you use in collecting data, and analyzing your data. Chapter 4, discussion, conclusion, and recommendation. Ideally, this is where you're supposed to convince your reader that you did a good job. But probably because you were found wanting, I noticed you didn't do well at all in this area. In fact, your discussion of finding is sounding like an area for further research. And I think the reason why it's like this is because you failed in adopting the right approach in your data, method of data collection and analysis. Ideally, your discussion of findings should reflect your objective of the study and should be geared toward answering your research questions. But what you have here is totally out of place and not acceptable. Please, you have to rework and present it in a way that it will capture both your research objectives and your research question. So I would suggest you take this up. I would suggest you take this up. Better still, you place it under a new subheading and title it Area for Further Research. So your discussion should be in themes and in line with your research objectives and research questions. Please, our advice in line with this, you should see the comments I made on 3.2 with regards to your method of data analysis. And while working on your discussion of findings, please, this is where you are expected to discuss what you were able to find out and how it relates to some of the findings you figured out while reviewing those relevant literatures. And I also noticed that you failed to do the right thing under your discussion of findings because you totally forgot or neglected the importance of adding theories into your work. If you go through this work, you notice that there is no place of theory. You did not review relevant theory, neither did you adopt any theory. So please, you go back to this work and look for the appropriate theories to use in this work. Your conclusion, you oftentimes say people with disability, please rephrase and take notes to ensure you make the needed corrections where necessary by replacing it with persons living with disability and lots more. I have little or no concern, or I have just small worries about your recommendation. And the area I was considering or looking at it is that for you to maintain that flow of your work from the beginning to the end, your work must fall within the expounded boundaries of your topic, your objective, your research question. But then I noticed your recommendations are a total fallout of your objective and your topic. Although you're able to capture some, like for example, bullet 2, you're able to say to promote cultural competence. Social work organizations should prioritize promoting cultural competence among social workers to better understand and respect diverse cultural backgrounds of clients, including persons with disability. That's cool, and lots more. So please try to see how you can capture some of your recommendations to make it in line, to put it in line with your objectives. For example, one of the objectives of this study is to figure out the perceived importance of communication skills in social work. And there is nothing in your recommendation that is capturing that. So please, I would advise you do the needful. Your reference is not totally out of place. At least you were able to, you tried your best. And if I should send back this work, you notice I was able to do some correction, a lot of corrections anyway. But then where the area I was concerned while going through your work is, for example, you see the third reference there, Adepuju F. et al. Now, the idea is, in your end-text references, you're expected to spell out all the names of the author. But here you're still having a Adepuju et al. Please look for the other names. Make sure the references are in line with upper 7th edition, and make sure you list the names of other authors, right? And Afolabi S. et al., you made the same mistake there. Afolabi S. et al., please list all the authors. And there's, okay, you go to Otoba J and Eneremadu V 2019. You just said communication skills and social work practice in Nigeria, a case study of persons with disability, Nigeria Journal. Please, that reference is not complete. It's not complete. So try and complete it. And I also noticed that some of your in-text citations are not in the body of your in-text citation, your in-text references. So please make sure what you have in the body of your work reflects at the end of your work. That's the list, your list of references, and what you have in the list on your list of references should also be in the body of your work. I believe that if you make this needed adjustments, this work will be better than the way it is now. Thank you.
Thank you so much, Shoka Bina.
Thank you so much. We appreciate you, sir. Thank you, sir. Thank you very much, sir.
Okay, thank you very much, Shoka Bina, for the detailed review of Group 1 paper. We want to assure you that all you have pointed out will be corrected by the group. I also want to say that for all the candidates, you agree with me that we have on the wall of the class, upper 7th edition. We do well to go back to the wall and look for the upper 7th edition. I know that some groups have those materials that were posted to the group in their own group as well. So each group that doesn't have that should go and pick from the general group to their own group, so that it will be easier for you to check what you need at every point in time. And also the guideline was also posted some time ago on the wall. That's the seminar guidelines also there. Pick it and domicile it in your group so that you can jointly look at it together to enable you make necessary correction as to the format that the paper should follow. Group 3, thank you very much. You have all the presenters in class. Group 1, you have all the presenters. Group 2, you have only one presenter. And Group 3, you also have only one of the two presenters. Like we said, this forms your points for attendance. So tomorrow will be another day. Let's come early. It's 9 o'clock. We are starting 9 on dot, like we started today. And we will not waste much of our time. Tomorrow we have 7 papers to be presented tomorrow. Before 1, on or before 1, we should be able to be done with it if we are as sharper as we are today. So please inform your group members present so that you will not be losing points. I said when we started, I said it a number of times, this course is pass and move, fail and stay. And you're already seeing it as it's unfolding. So I believe that tomorrow we'll have greater participants in the hall. Before we close, if our executive director have something to say concerning all that has been done today, please, sir, come on board. Thank you very much.
Thank you very much, our able coordinator. It has been a very useful engagement. I've painstakingly listened to the presentations made and the review also made. I will say a very big thank you to both the presenters and the reviewers. A lot of discussion have been made, and I want to thank the presenters took notes on the points and areas of observations made. The presenters each from the beginning took their time to analyze the research work. They made various input from the level of the topic, and delve also into the body of it, talked about the methodology, and even draws a small sample of what the conclusion should look like. I want to say generally it's a good work, but a slight observation at my own part is that a lot of us made effort to introduce theoretical frame. And then I'm not seeing where the theoretical frame is also being used to analyze the work or applied to the work itself. Perhaps I wasn't listening very well, but I can recall I've not had one of the presenters using the theoretical frame to explain the work itself. I want to say that the theoretical frame that is expected there, applicable theory is not just for mention. It is a tool that will be used to analyze and give light to the work and make the work also lead reasonably to where it becomes very scientific. So since we have an opportunity of working further on the papers or the chosen research, I want to think that at the end of it, it will come out with something very fantastic and something that could look very true to life. But let's be a little bit careful to be sure that the presentations are not just a write-up. The presentations are expected to be a live issue, something we've taken time to engage people and then draw reasonable inference on them. So we have the opportunity of reworking and letting us have a good documentation on this so that we can also build a good library on this work. And again, I want to think that the next set of people too, who are also going to come on this program, we'll be looking at recommendations and areas of taking forward from this. So it's not just a one. That's also a one-go affair. What just happened now is what I also observed, the use of the Zoom line. I realized that the participants are also frequently putting on their microphone at will and then stopping and distracting the platform. This is not a very good one. Social work has to do with discipline. We devote time for this and then make sure that the time devoted for this does not affect others. So I want to say a very big thank you to you, and a very, very big thank you to the coordinator. A big thank you also for all the viewers that spared their time to be with us and then did justice to this very presentation. Thank you so much, coordinator. I appreciate you.
Thank you very much, sir. We appreciate
Thank you so
you.
much, sir. Thank you very much, sir.
So we expect all the papers from our reviewers to come in so that we can send back to the group to do the needful corrections and then return back to the reviewers so that can be looked at. Like I said, these papers are going to be published if eventually the reviewers certify for presentation. Then we'll contact each group to make provisions for the publication in the social work professional journal of the institute. So by tomorrow, we'll meet again. Thank you for being here with us. And for those who have not presented, you have seen what it is like. I believe you have just been able to tap into what others have done or presented so that you can make yours better for tomorrow. And I'm very sure that it's going to be also interesting, like we have today, and we're going to be going home with more knowledge and skills of how to ensure that our work also come out to the world as practice. It is not only just in academics that will always be writing papers. Our wealth of experience also counts, and also we should research more into what we are doing and bring it out to the world so that at least those who are caught behind us and those who want to also use our work or data for further work will be delighted to do that through what we are doing now. We are producing a different species of social workers, different from what we know it to be before the federal government gave us the chartered bill as a professional body, so that all of us can have better practice. All of us can also be part of the change that we require in the profession in Nigeria, in Africa, and in the world. And we are doing it in our own little way. So each one of us should also contribute to do it, to take social work into an enviable position among the committee of professions in Nigeria and beyond. So I want to say thank you very much once again for this evening as we gear up tomorrow, 9 o'clock. Thank you and enjoy the remaining parts of the evening.
Thank you very much, sir.
Thank you, sir.
Thank you very much, sir.
Thank you very much.
We
Thank you very much, sir.
God bless
Sorry,
you,
sir. I raised my hand. I want to ask a question.
Wakama.
Sir?
Thank you.
I wanted to
You
find
can
out,
do that,
sir.
you can do that just
Our
tap
two
me up, please,
presenters.
Wakama.
Okay, sir.
Well done, oh.
Okay, sir.
Thank you, sir. God bless you. God bless you.
Thank you so
I
much,
really
sir.
enjoyed it.
Thank you.
Leave, oh, at the party.